So a little over a year ago, ACNJ received a planning grant from the Pritzker Children's Initiative to develop a plan to expand equitable access to high quality services for young children prenatal to age 3 in New Jersey. It came with an incredible challenge. The plan had to ensure that 25% of low-income children in New Jersey, prenatally to age 3, have access to high-quality services by 2023. That is 27,000 children. ACNJ then pulled together a leadership team from the public and private sector, leaders in many of the state departments, as well as community leaders, and supported by many community partners. And we met intensively starting last July to talk about what this plan would look like. The leadership team is identified in the report and in the executive summary, and you'll hear from some of them today. It took us about 8 months to develop this plan, and we were serious about it. We felt that this was an opportunity to address those issues that cut across all of these concerns. How do you finance a system? How do you ensure that it is coordinated? How do you build capacity? And I think in that context, there was a great deal of consensus around how to go forward. There was also consensus that equity was the strong theme of this plan. So the plan is challenging. It maps out how to expand services in several key areas: access to high quality childcare, home visiting, infant mental health, and infant and maternal health. The crisis we're experiencing now, not only the pandemic, but the economic uncertainty in our state and the civil unrest we see across the country, has made this even more challenging, but it has also made it more important. It is clear how critical these services are for our youngest children and their families. In this time of crisis, they have been a lifeline. So before I introduce Gerry Cobb, who's the executive director of the Pritzker Children's Initiative, who will be followed by Diane Delano from ACNJ, I want to talk about what we hope to do today and what your role is today. The ability to do this virtually has allowed us to have many more people participate than if we were meeting in person, but it doesn't allow for conversation. We want to continue the conversation. So today is not an end. It's a beginning to hear from all of you. It can start by comments, any comments or questions you want to put in the chat box. We will follow up on those. The report is available on our website, the executive summary and the report, and all the supporting documents are available. And we'll be putting a link to the report in the chat box. I hope you use that for questions, comments, and even more important, for your commitment to work with us to make this plan possible. So now let me introduce Gerry Cobb, who's the executive director of the Pritzker Children's Initiative, which is funded by the JB and MK Pritzker Family Foundation, which has been a champion of high quality early learning for 2 decades. Gerry has a long career in and commitment to high quality early care and education for young children. She has served as the executive director of Smart Start's National TA Center in North Carolina, then as state services director of the National Build Initiative. Most of all, to me, I've known Gerry for many years. She is an inspiring leader and a real supporter of state advocacy. She's a great resource to us, and we appreciate the fact that she believed in us as we finished our planning process and made the case that we needed to be one of the states that Pritzker supported in implementation. So let me turn this over to Gerry Cobb. Very happy you were able to join us today, Gerry.
Thanks so much, Seal. I appreciate that. First, I want to just say, wow, your first lady is amazing. And I definitely want to clone her and take her on the road. I was already writing down people that needed to be connected with her. Seal has talked about how fantastic she is, and Governor Murphy, and all the great work you're doing in New Jersey, but hearing it directly in her words today was very inspiring. So thank you so much. I am so happy to be here today and honored to be speaking with all of you. I've been a fan of the work in New Jersey and all of the people involved in this work for so many years. I've watched all that you've tried to do in the early childhood realm for a long time, the challenges you face politically sometimes in moving forward an early childhood agenda, and the commitment to collaboration, even at times when that was discouraged by some. You guys have kept moving forward through the good times and bad. And now, ironically, when I say this, you are clearly in the good times. Yes, you're in a tough situation now with COVID, but you have the commitment of your governor and first lady and legislators and great leaders in your state government at all levels. And you have wonderful private sector partners. Despite all of the challenges right now, you are making it happen and working to keep the ball moving forward. And that is so exciting. The Pritzker Children's Initiative is, oh shoot, sorry about this. I was supposed to share my screen. I'm doing that now. There we go. The Pritzker Children's Initiative is a project of the J.B. and M.K. Pritzker Family Foundation. J.B. Pritzker, the governor of Illinois, and his wife, M.K., the first lady, are our funders. For J.B., a passion and commitment for early childhood has literally been a part of his DNA for several decades. He funded a lot of the early work of Jim Heckman and Jack Shonkoff. He was one of the early strategists around an early childhood pay for success approach, not because he wanted to make money from the investment, but because he hoped if the private sector seeded a strategy and showed that it worked, then maybe it would make the government pick it up and run with it and fund it. He wrote a book about why philanthropies should fund early childhood. And now he's committed $1 billion to assuring that the entire country is prioritizing infants and toddlers and their families beginning prenatally. We don't officially get to talk with him now that he's governor. Prior to his inauguration, we gave him a preview of our plans, and he gave us his stamp of approval and the funding to make it happen while he was in office. We now keep what we call a happy book with all the things that he'll want to know about when we eventually do get to talk to him. And in the meantime, we're following his work in Illinois, and he's putting state resources towards these same priorities at prenatal to age 3. As part of the strategy that now Governor Pritzker approved prior to his inauguration, we launched in January 2019 a national grant competition. We invited every state and the District of Columbia to apply for a grant to develop a plan to move forward improved policy and state investment in a system of services for prenatal to age 3. People kind of poo-pooed the idea of the competition, and most people thought we wouldn't get very many applications. Who would want to focus on prenatal to age 3? And that was the focus of our planning grants, but we proved them wrong. All but 3 states applied. All but 3 states told us they wanted to prioritize a prenatal to age 3 agenda. It was an amazing measure for us of the readiness and enthusiasm in this country for prioritizing the needs of infants and toddlers and their families. And now today we're funding coalitions in a total of 20 states to implement a prenatal to age 3 agenda. The Pritzker Children's Initiative has a national goal of equitably expanding services by 2023 to at least 1 million low-income infants and toddlers and their families beginning prenatally. Every state and community we're funding has a goal to expand services by 2023 to at least an additional 25% of low-income infants and toddlers and their families, and to an additional 50% by 2025. For New Jersey, they took this requirement of the grant and they, stepped up even further. So their goal is by 2023 to expand services to nearly 29,000 infants and toddlers and families, and by 2025 to hit nearly 59,000. So we're excited to see the possibilities. So New Jersey is now part of the network of 20 states and even more communities that are prioritizing a prenatal to 3 agenda. But I fully expect that New Jersey will be the trailblazer for the entire network of states. I regularly share what you're doing with our 50-state mailing list of state, community, national, and foundation leaders. When we were reviewing the state plans, New Jersey's was immediately one that stood out. Many other states had to go through a site visit process, but New Jersey was at the top of our priority list of states to fund for implementation, and we didn't need a site visit to confirm that decision. You guys had clearly taken this work to heart, and we were regularly hearing of the great work you were doing throughout the planning process. What is so impressive in your work is that literally everyone is at the table now from the public and private sectors, and that there's such commitment and accountability for the work at all levels of government and in the private sector. Everyone seems to understand the importance of prioritizing prenatal to age 3 issues. It's been inspiring to watch all that's happening in your state, and we all thank you for it and look forward to watching how your work evolves going forward. I fully expect that I will be holding you up as a model for what is possible when the public and private sectors come together to build a better system for babies and families. I was asked to talk about why it's important to focus on babies, and I'll cover that, but definitely feel like I'm preaching to the choir here. You guys wouldn't be participating in this meeting if you didn't already think it was important. I want to cover a few key points that I think are important to raise as part of the great work you're doing. First, of course, we all know about the essential period of brain development that occurs in that prenatal to age 2 period of life. If you can assure that children and families are getting the right supports during this period, then you're close to your goal of getting children ready for school. That means getting mothers the right prenatal care and nutrition, assuring they have access to health coverage pre and postpartum, providing home visiting supports and other resources if they want it, assuring there is an adequate and affordable supply of high quality infant and toddler care for every baby that needs it, and assuring that infants and toddlers are getting their well child visits, immunizations, developmental screenings, and early intervention services where needed. We all know how important it is. New Jersey has done a great job of building a high quality pre-K system, but you've got to start younger. You've got to start at the beginning, and then pre-K builds on the foundation you've laid in a child's life and finishes that work to get them ready for school. But if you only rely on pre-K, it's not enough. But you already know all this, so I'm not telling you anything new. You guys have that much bigger vision. What I want to make sure you know that you may not be aware of is new research that has come out of the Center for the Developing Child at Harvard. They released a new report in the past couple of weeks that makes the case that early childhood development is completely intertwined with lifelong health. What they tell us is that the science is clear on 2 key points. What happens during this period can have substantial effects on both short and long-term outcomes in learning, behavior, and both physical and mental health. And all of these domains are connected, and the potential for learning is linked to the quality of physical and mental health. What this means is that a child who is living in an environment with supportive relationships and consistent routines is more likely to develop well-functioning biological systems and brain circuits that promote positive development and lifelong health. Of course, this makes sense. We knew this already. What we may not have fully known, though, is that children who feel threatened or unsafe early in life, or have food insecurity or lack of housing may develop physiological responses and coping behaviors that are attuned to the harsh conditions they're experiencing at the time. And this early childhood trauma, if not mitigated in those early years, will have a lifelong impact on their health. And that gets us to the dollars and cents of healthcare. What they've found is the existence of stress and trauma in a child at the very earliest age, if not mitigated, can lead to heart disease, diabetes, mental health challenges, autoimmune diseases, asthma, the list goes on. And look at this slide. We spend this much money annually on these health issues as a country, and a good portion of this could be mitigated if we were minimizing the impact of stress and trauma in a young child's life. And on the one hand, this sounds pretty far-fetched, that there would be that kind of impact 20 or 30 years later on someone's health. But on the other hand, think about how your own body reacts to stress on a day-to-day basis now, and how that shows up in your own health. And this is a little baby whose body and brain are still forming. They might not be able to talk, but they can pick up the clues that cause them to react with stress. if their families are feeling a lot of stress or yelling, if they aren't getting good nutrition, if they're spending their days with no one holding them or talking with them or stimulating their brain, it makes a lot of sense that there could be this kind of impact later in life. But to read this new report from the Center for the Developing Child, if you haven't had a chance, and see what I'm talking about, and there's a link to the report at the bottom of the slide. And second, we need to have you calling out your priorities related to prenatal to age 3 over and over again, and incorporating key messages related to infants and toddlers. In your public comments, are you specifically talking about the very specific needs of infants and toddlers, or are you simply talking about early childhood and young children or child care? If you're speaking more generically about young children, no one is going to think about babies and what they need. You've got to call it out. And likewise on your policy priorities. When you're designing policies related to health care coverage and child care and supports to families and prenatal care, are you designing them intentionally to assure high quality services for infants and toddlers and their families and for their mothers beginning prenatally? The public and the policymakers need to understand explicitly the unique needs of infants and toddlers and families. One of the things that we've learned is the babies get left out if it's more of a generic approach to policy and communication. And I'll give you an example as it relates to child care. A lot of times what we're seeing is that states are setting subsidy reimbursement rate increases that are across the board instead of honing in on specific costs and strategies for infant toddler care versus those, providers serving 3- and 4-year-olds. If you do that across the board increase, those serving 3- and 4-year-olds simply make more money, or at least get closer to a profit level, which is completely understandable. They should do that. But the gap widens in the cost and reimbursement rate for infant and toddler care. It's much more affordable for providers to serve 3- and 4-year-olds than infants and toddlers. As providers think about reopening their businesses now, and whether they even want to reopen, why would they reopen a business serving infants and toddlers when they're losing money every day? It makes much more sense to only serve older children. That's where the profit is. So you've got to structure your reimbursement rates to incentivize providers serving infants and toddlers. If, of course, you want those parents working. This slide just gives you a general example of the cost gap. It's just always striking to me and wanted to share it. Now, these statistics that you see on this slide were drawn from a southern state. So take these numbers and likely double them for New Jersey child care. And this is an average example across all child care. But look at the gap. For infants and toddlers in this example, the difference between the actual cost and the market rate, and in this case, what subsidy is paying for, is nearly $4,000. And that's for a lower cost southern state. And then you look at this next slide. When you crunch the numbers and show the difference in cost for minimum licensing for infant toddler child care versus care for 3- and 4-year-olds, and then you do the comparison for high quality care for infants and toddlers and 3- and 4-year-olds, the difference is pretty striking. It's a gap of over $6,000 in the actual cost of care in a high quality setting versus what the market rate is or what the state is paying for reimbursement of subsidy for infants and toddlers and child care. Now this is again data from a city in a southern state. I don't have this data for New Jersey, but it's data you should be looking at if you have it. Louise Stoney has done this analysis for a number of states. The only one where she's seen an exception where there isn't such a cost gap is in Boston, Massachusetts, because they've structured their rates very intentionally and not thought in terms of across the board percentage increases, but what is the actual cost for quality of infant toddler care, and what does the city need to be reimbursing. But generally you see this same example over and over again across the country. We've set child care up as a business model, but what business model that you know of encourages people to go into business and lose money? If we want providers to go back into business and provide high quality care for infants and toddlers so their parents can work, do we need to think about a different approach to this model? And the same with pediatric care as another example. There's several states trying to find ways to extend the well child visits so that pediatricians can give more support to families with new babies. What are we doing to assure that happens and that Medicaid or managed care providers or your state CHIP program are paying the cost of that extra time? And the list goes on. All of this has to be intentionally designed and put into policy, or it simply doesn't happen. And that's what you've tried to do with the plan that you've created that we're trying to support as part of this grant. And finally, and most importantly, you've got to be thinking very intentionally and strategically about equity. And that was clear from First Lady Murphy's remarks today. As you may know, the Pritzker Foundation is fairly obsessed with numbers. If you don't know that, you will find it out. We regularly think about what those target goals are and how to get to them, and whether we're able to measure actual success. And we know that it means absolutely nothing if we've increased investments and expanded services, and they're going to the same families, and families that are not reflective of the diversity of each and every state. So achievement of your goal won't mean anything if you haven't created a system very intentionally that uses strategies that assure you're reaching the families and children of greatest need, and that no one is being left behind. And again, I hear that, I see that in your plan, and I hear that in the remarks from the First Lady. It means looking at your system now and the services you have and how they're spread across the state. Who are you not serving? Who isn't getting child care subsidy or has their child in low quality care? Who isn't getting early intervention services? Which children are being born with low birth weight or other health challenges? Did their mother get the right prenatal care and good care in the hospital during childbirth? And how are you reaching families of different cultures and ethnicities? And does your workforce speak their language? Who are you missing? And most importantly, when you disaggregate the data and look at who you've served, have you increased or decreased the racial disparities in your state? Are children of every race and ethnicity and geography getting what they need? What systemic barriers are leaving them behind? Are children of every race and ethnicity and geography getting to school ready for success? It doesn't happen by accident, the disparities or the successes. They're both intentional. And again, I feel like I'm preaching to the choir. You guys are there, you're seeing what needs to happen. And just a couple more final slides, and then I'll move on to the panel and the more important discussion they have. But I just thought, we've seen, I'm sure, over the years, everybody, the equity versus equality slide. And I thought this one was interesting and thinking in terms of distribution of services across communities. Because we talk about taking a universal approach, and that seems great. But what we know about universal approaches is that if you're not intentional in reaching everyone, you're going to leave some children and families behind. And often those are the children and families of color. So what is going to be different in your work on this prenatal 3 agenda to assure that doesn't happen? You guys have been so intentional in building out your local infrastructure as well over the years. And I think that is a critical piece of what's going to help you be successful, because you can customize to the specific needs of children and families and communities. And in this particular time that we're in now, there's so much more heightened awareness of the institutional racism in our systems and the fact that there truly is not equity in the services we're providing. We have an opportunity now to capitalize on this moment in time, and as we are building back our prenatal to age 3 systems, to build them back better than they were before, and to build them back in a way that gets to equity of services and financing, so that each and every child, regardless of race, ethnicity, geography, or income, gets what they need to be successful in school and in life. And this last slide, just to wrap things up, gives you some examples of federal initiatives where they tried to intentionally build equity into the policies related to the funding. Of course, even with these, it all comes down to how they're intentionally implemented at the state and local level, and how you actually structure the programs and the outreach to the families to achieve your goals. I'm excited about the path you're on, and look forward to seeing how you evolve and where you get to, and lifting you up as a great example to the country of what is possible when everybody comes together to make this happen. Thanks so much for all you're doing, and look forward to working together in the coming years to make New Jersey truly the best state in the country to have a baby and to raise a child. So thank you.